Well, hello, Grenada, Carriacou, Petite, Mourning, and the world. Welcome to another Mikey Live program. I am your host, Mikey Hutchinson, Rasta Mikey. And of course, we are coming to you from the Spice Isle of the Caribbean. That is Grenada. The pleasure is mine to be back with you for another day. And I hope you're good. How's it going? How was your night last night? I mean, since we last spoke, what's up? Listen, there's so many things that are happening, man. I mean, like COVID has changed everything. And all you hear these days is a COVID and a COVID and a COVID. It's like nothing else exists right now, right? We used to have even the hurricanes afraid to pass through the region. I kid you not. This is what? This is supposed to be one of our busiest times as it relates to tropical cyclones, and nothing nagasa. Usually we have a bad cold around them kind of time they so. After carnival and then kind of thing, nothing nagasa. Everything that used to disturb our way of life around this time of the year, the seasonal things. What? On a you don't see mosquito. No, I'm serious. Even mosquitoes don't want to bite. I'm telling you. Time's hard. Folks, it's my pleasure to be here again talking to you. You know, we are in the land of the living, thanks to God. Now, on a more serious note, let's take a look at what we'll be talking about tonight. Grenada recorded 5 more COVID-19 related deaths yesterday. You understand? September 25th and 26th declared National Days for Spiritual Reflection. PWU is not recommending health workers walk off the job. They say nah. NDC wants government to withdraw a statement. COVID-19 cases in Carriacou is spiking, and representatives of the Grenada ruling and main opposition party meet to discuss collaboration in fighting COVID-19. And we're going to talk to you about living in a household with suspected cases of COVID-19 and people in isolation and so on. I think that is now becoming a growing concern. So we have a nice piece for you on that. And the alert level is lowered at the Soufriere volcano, and that results in residents now being able to return to their homes. So we have all of that and more to talk to you about when we return from our first break. We got to let you know that the headlines was brought to you through the kind compliments of the Communal Cooperative Credit Union, Coats Grenada Limited, Digicel, Nawasa, the Housing Authority of Grenada, Superb Distributors, and the Real Value IGA Supermarket. Thank you very much, every one of you, for joining us. It's a pleasure to be back with you again. If you have not yet done so, we'd like to encourage you to please go ahead and share the business. You see, when you share, that's when other people get to know that we are live on the business. So folks, go ahead and share. And again, remember that someone sharing tonight's program will receive some free credit. Compliments, Digicel. We'll be back. Hey, and by the way, that person could be you.
Running low on groceries? Why not visit realvalueiga.com and experience our new online shopping platform? Place your order, then go out and enjoy your day to spend more time with friends and family. Free delivery available within select locations or in-store pickup available. Sounds simple, right? It is. Stress less, live more with Real Value IGA online store, where good food begins.
After being locked down during the pandemic, get ready for summer with Rika. Live this summer with Rika's Summer in Every Drop promotion. Buy any Rika combo of 6 200ml, 4 330ml, or 3 1-liter Rika juices and get a chance to win. Win Apple AirPods, plunge pools, beach dress with umbrellas, barbecue grill set, gamer set, and weekly pop-up giveaways. With Rika, there's Summer in Every Drop. Promotion ends August 31st. Tickets available at all leading retailers island-wide. Rika, distributed by Superb Distributors Inc., Tempe, St. George's.
It's your summer everything loan from the Communal. Borrow up to $10,000 for all your needs. School supplies, staycation, home renovations, appliances or furniture. You can have it all with a summer everything loan. With competitive interest rates and same-day approvals, you can't beat this loan special. Not a member? Join today to get onto this exciting offer. It's your summer everything loan from the communal. Apply today and take advantage of this exciting offer. Visit the nearest communal branch or call us at 440-1755 for more information. Lending terms and conditions apply.
How going on, boy?
Hey, good old things.
Hey, they easy.
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex or give them a call 440-1015 or 440-1016 or check out their website hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.
Diamond Intercontinental Jewelry Store now has amazing deals, special discounted prices on wedding sets, watches and selected jewelry. We sell top brand jewelry and watches like Citizen at the best price. We offer the best deals and customer service on the island. Opening hours Mondays to Saturdays 9:30 a.m. to 5 p.m. Diamond Intercontinental Jewelry Store, located at the Esplanade Mall, St. George's, Grenada. Visit or call us today for 14-3114-232-1234 or WhatsApp 533-1581. Sale is on for a limited time only.
Are you prepared for the hurricane season? Do you have a plan? Remember, water is essential in any emergency plan. Determine your family's water needs. Ensure your storage containers are food grade and store at minimum 35 gallons of water per person per day for at least 1 week. Understand that your planning may be different this year because of the need to protect yourself and others from COVID-19. Take the necessary actions to ensure that your household has an adequate stored water supply should there be an interruption. Be prepared. NOWASA, committed to meeting customers' needs.
All right, family, so welcome back again. Now, let's talk about the dashboard from yesterday, boy. What we discovered from that was that 5 more of the nation's citizens died as a result of complications, according to health officials, associated with the coronavirus. To date now, there are 43 persons who have died from COVID. Now, among them, a long-standing media practitioner, Mikey P, RGPF assistant Superintendent Byron Klein. Today, we heard of the passing of another prominent citizen. You understand? Mr. Devon Franzique, who is known in the pageantry world. You know, it's crazy. And there are a lot more other prominent persons who have died. Today, again, we hear of another police officer who died as a result of COVID-19. 290 new positive cases recorded yesterday alone as a result of widespread testing that was done by the Ministry of Health. That brings the total active cases to 2,210. They are saying that all these people are in self-isolation. Well, I don't know about that. I don't know about that, Pat, because I received confirmed information of individuals who were positive, COVID-19 positive, and were still in the market square, interacting with other people. No, I'm not going to say what I don't know. Understand? And this comes from a very credible source. That despite warnings and so on to those individuals, some of these individuals still go out in the public simply because they don't subscribe to the whole COVID narrative. So they're saying, you know what, it ain't no COVID here. So it ain't no COVID here. Even if they test positive, they're not going to follow anybody's directive. And who ends up paying for that? Granny, grandpa, children. But hold your head so hard, boy. Hey, you know that don't sneeze should have a limit, you know. You know what I mean? Don't sneeze should have a limit. If you ask me, you understand? People are dying. No, it's not time for that. No, it's not time for that. You know what I mean? People are dying. Anyway, going back to the people's story here, Papa. There were 62 persons in hospital yesterday. That number might have changed by now. The local confirmed cases since the virus was first identified here in Grenada in March of last year now stands at 3,030, and 777 have so far recovered. Yeah? Earlier, with COVID-19 on its wave of destruction, the Grenada government calls for a day of prayer. Well, we're getting more than one. It has been declared September 25th and 26th as National Days for Spiritual Reflection. On this score, the government is encouraging all religious and community leaders to unite and organize special virtual activities during that period. Now, this is said to be in recognition of the critical role spirituality in dealing with the impact of the pandemic. So there are different approaches, because I was saying the same thing too. Other things, other methods of recovery and treating COVID is distracting us from our Maker, our God, because we are now so reliant on other means of coping that we forget our Maker. So they're saying here that, you know, this could be a time for that. You understand? So these are the days that is designated for that. Olio, we're moving on. Now, the Public Workers Union says it is not recommending health workers leave or walk off the job. What they're saying is what they prefer is measures be put in place for the health and safety of these workers. They're saying things get tight, it's tough. And also, although they know that things are tough, they understand the commitment of the workers. So they're not asking for the workers to leave the job, but they're asking that the authorities pay specific attention to these workers' health and their safety.
That's a very tough question. And given the commitment and the dedication that health workers have for their profession, I cannot see health workers making the decision to walk off the job. And certainly while our country is fighting and battling with the Delta variant of the COVID-19, that is not a decision that the PWE would want to make at all. What we would want to do is to partner with government, is to collaborate with the officials to put simple measures in place for the protection and safety of healthcare workers. That is what we will fight to do. Because at the end of the day, what all of us want is a Grenada as the ILO, International Labour Organization, which was established in 1919. As that organization has said, when a country plans to deal with COVID-19, it must plan for resilience. It must plan so that at the end of the day, whatever ravages this disease has had on your country, at the end of the day, in whatever form or circumstance, the country must still be able to stand. And that is what the PWU is about. That is the science that we are following. And let's mark our words. The science that is guiding COVID-19 throughout this pandemic is not just coming from the WHO or from the PAHO. It's also coming from institutions like the ILO and Public Services International and Caribbean and Public Services Association. Those organizations have a lot to say. They have been monitoring the pandemic. They have been carrying out research, conducting surveys. The professionals are speaking. And we are saying to the health authorities, even more than ever, this is the time when the voice of the union should be listened to, because we are speaking from that scientific perspective.
That's the Public Relations Officer of the Public Workers Union, Daisy Hazard. She says that healthcare workers are finding themselves asking for things they are not supposed to be asking for.
And so what we're asking for are the basic things that our healthcare teams are asking for, which they should not have to ask for. They are asking that the COVID units be relocated immediately from the general hospital. They are also asking for there to be at least 1 or 2 isolation centers around the island where healthcare professionals who have fallen sick with COVID based on their home circumstance should not have to go back into their households to try to recover so that they can come back out to work, but that they can be accommodated and taken care of in government facilities. They are asking for proper PPEs that can fit them. They are asking that when they have to go into the COVID bays, that they at least be provided with hazmat suits to put over their PPEs. They are telling you COVID patients vomit. There's a lot of fluids and secretions coming from COVID patients. And so even when you put on a little mask and a gown, if someone vomits over you and it spills onto the bottom section of your foot or so, there's no way for them to bathe before they get onto the staff buses. They are asking, please, for a little room to be created in some of the wards where they can change, and another room where they can take off the dirty clothes. As it stands right now, they are going into the COVID wards, putting on the clothes there, taking it off there, getting into staff buses and going home. They are asking for meals. They are asking for reliable transportation to take them home after they have finished a 12-hour shift. Now, we have seen in this week, the Ministry of Health putting some things in place towards that. But why did it have to wait until 1 month after COVID?
All right. Thank you very much, Daisy Hazard. Now, we have also received reports from some healthcare workers who say, particularly nurses, that passengers aboard buses are scorning them and treating them with scant courtesies once they know they are coming from medical facilities. They are saying that people don't want to sit next to them on public buses. Okay, that's an interesting piece. Very interesting piece. I wouldn't say that everyone is experiencing this, but we have received reports about that. And of course, one healthcare worker who didn't really want to go on camera or anything like that is asking people to understand what their role is in curbing the current outbreak. They are the ones who are out there fighting and doing odd hours and lengthy hours to make sure that we are all safe. The least they can do is feel comfortable when they're out in public. And they are saying that they're asking, for you to understand that and treat them kindly. All right. Very interesting. Are we different there? We're different. Okay. The healthcare system is under a lot of strain. Yes. Even authorities have admitted this, that there are a lot of healthcare workers who are currently in isolation or at home because they have contracted the virus. Well, soon these workers will be back on the job because there were some who were infected more than a week and a half ago. All right? So, wow, it's just crazy. In Carriacou, the cases are spiking there. 14 new cases of COVID-19 detected today. Okay, 67 are currently active in Carriacou, and there are 2 in Petite Martinique. Now the numbers would seem a little volatile because what's happening is that some other persons are transitioning to the mainland, so that is why it would not count again, all right, as an active case in Carriacou itself. However, in terms of active case, confirmed cases in Carriacou, since the first case was detected not very long ago, they have detected so far 83 cases of COVID-19 in Carriacou. All right, and they're saying that they are continuing with their contact tracing. All right. The next thing that we have to tell you about, boy, the National Democratic Congress. Now, they want the government of Grenada to withdraw statements that they made as it relates to an ethics committee that is set up, to deal with persons going into the hospital who they admit. And that's in the event that the numbers, in the event that all the beds are filled. All right, or that there are only a few more beds available. That committee is going to determine who is looked after and who gets turned away. And so how it was expressed by the Minister Minister Steele says that, eventually, and they hope that it doesn't have to come to that, they'll have to determine who lives and who dies. Wow. And that's a tough one. I probably wouldn't use those words myself, because being turned away from the hospital doesn't necessarily mean that you will die. Yeah? But they want the government to retract those statements. And in a press conference earlier this week, the National Democratic Congress made that call.
The Minister of Health is on record as telling the Grenadian people that an ethics committee will be formed. And the role of this committee is to determine who lives and who dies. Grenadians, I am disturbed because at this point in time, this is not the moment to spread any sense of doom and gloom in our society. This is a moment, my brothers and sisters, for we to show a little more caring, for we to reach out to the people and let them know that we have hope. There is hope. We're going to protect them. We cannot, as a government, as the leaders in this country, give up. We cannot give up. The moment is for we to rise to the occasion and give the people a sense of hope. The National Democratic Congress is very disturbed by those statements, and we are calling on the administration to stand up, show them manhood, show them maturity, and say to the Grenadian people, I think we made a fundamental mistake by making those announcements. We are sorry, and we have withdrawn those statements. And we are prepared to do what is necessary to make sure that every single life is important, and we will put all effort to ensure that we do what we have to do so that everybody could survive this pandemic.
That's the National Democratic Congress. What we can tell you is that representatives of Grenada's 2 main political parties held discussions today on fostering greater collaboration in addressing the COVID-19 pandemic and its current impact on the country and its people. Initiated by Prime Minister Dr. Keith Mitchell and readily accepted by acting political leader of the National Democratic Congress, Adrian Thomas, the gentleman you just saw, the meeting underscored the need for unity in addressing COVID-19. Other attendees included Joseph Andel of the National Democratic Congress and Anthony Boatswain of the NNP. After successfully managing the pandemic for more than a year, Grenada transitioned to community spread in recent weeks. And as of September 15, the country recorded a total of 2,210 active cases, the majority of which are locally transmitted. Thursday's meeting therefore underscored the urgency of the situation and the equally urgent need for a collaborative approach for curbing and towards curbing the spread of the virus and addressing vaccine hesitancy among Grenadians. Discussion points included the quarantine period for fully vaccinated persons entering the country, increasing the number of testing and vaccination sites across the country to reduce the potential for crowded venues, establishment of a separate isolation unit for COVID-19 patients, the recruitment of more volunteers to assist with public education and manning the COVID-19 hotline and improving the capacity of the hotline with support from telecommunications providers. Now, the meeting also identified the need to expand the list of potential beneficiaries under the COVID-19 economic stimulus package to bring greater relief to persons affected by the temporary closure of many non-essential businesses and who have been left without an income. It was also suggested that government encourage utility companies and financial institutions to offer moratoriums to customers as a means of financial relief. Efforts are already underway to address some of the areas highlighted, but there was general agreement to give consideration to more of these. Now, in addition to political parties working together, there was unanimous support for the idea for popular persons in the performing arts sector to work together to produce promotional material that will provide relevant messages in an entertaining format. Another suggestion was for calypsonians and soca artists to unite to create similar messages that will resonate with various sectors of the population. Mention was made of the willingness of persons in the diaspora to support COVID-19 initiatives in Grenada through donations, and the NDC representatives proposed possible concessions, an idea the Prime Minister commended the NDC for, and agreed that consideration can be given to a clear and transparent proposal for same. With respect to the distribution of relief supplies to persons in need, it was agreed that a non-partisan approach should be adopted using the National Disaster Management Agency and or community-based organizations that will maintain impartiality. All right, and so it goes on and speaks a lot of areas in which they can explore so as to have some positive result. Now, there's a serious situation that is brewing in Grenada where persons are claiming that they're calling the hotline. Some of them are not able to get to the hotline. People who suspect that they have contracted COVID-19 and have called for help. And it's been a matter of days. It's days and no one has come to them. The minister and the Ministry of Health has acknowledged the backlog of calls, and they also revealed that only there's about 25% of these calls that go to the hotline that will not be answered or addressed. So the situation is that persons are home who are COVID-19 positive and have not confirmed their status by virtue of having a test. There are persons who are in isolation as well, who need to know what next to do. Should they continue staying home or should they continue with their life as normal, go to work and so on? But that is following test results. If they are not tested, they are not sure what to do, they are to stay home. Despite that scenario, all right, well, given that scenario, not despite, given that the existence of that particular scenario, Dr. Mayana Charles has given some suggestions as to what persons should do if you fall under that category. If you're home, in isolation because you have come in contact with a positive case, or if you are positive, or if you suspect that you are positive, all of these persons, she's come up with some recommendations in terms of what you should do.
Thank you. We do understand that a lot of the homes in Grenada, most persons probably live in homes, probably 1 bedroom, 2 bedrooms for the most. And we acknowledge that it is a challenge and it can be difficult to isolate at home. I just want to provide some practical tips that person can follow when in home isolation. The first thing, if there is someone in your household that has been diagnosed with COVID-19, right, I encourage person to identify another member of the household to be the caregiver for that person. And while providing care, I encourage that individual to practice all the relevant measures. That person providing care should wear their mask at all times when doing so. And even the person diagnosed should also be wearing their mask. They should sanitize their hands and surfaces frequently after interaction with the case. I also, when practical, prepare a separate home or a separate room in the household so that the case can isolate and be separated from the persons who are not sick. Additionally, open a window or open all the windows to improve the ventilation in the household, right? If you do have a case in that household. And I want to urge again, everyone in that household should wear their mask at all times to prevent further exposure. As Dr. Sean Charles mentioned, we need to break the chain of transmission. COVID is transmitted in 2 main ways. Through 1, respiratory droplets. So when persons sneeze or they cough or they talk, right, those droplets can expose other persons to the virus. The other way is through direct contact. So when persons, again, they cough or they sneeze or they even talk, those droplets can fall on surfaces and remain there for hours and even days, right? So this is a mode of transmission, right? So the things we need to do to break the chain of transmission is to wear the mask, is to sanitize frequently, wipe surfaces with disinfectant, and so forth. Additionally, I encourage persons to use separate dishes, cups, and utensils from persons that are infected with the virus. And everyone in the household should be aware of the warning signs, the signs that indicate severe illness with the virus. Those signs are changing of the color of your lips or your nail beds to blue, becoming confused, persistent pain in your chest. So for instance, when you take a deep breath in, you start to feel pain. Or when you cough, you get pain in your chest. Or you develop a chest pain that just simply does not go away. High temperature that does not break with Panadol or so, or treatment. All these things are warning signs. Even difficulties breathing. And if at any point the positive case develop those warning signs, I encourage you to seek medical care immediately. Right? You can do so by calling the hotline, or you can also do so by calling your nearest health center directly, or accident and emergency, because this person needs emergency medical attention. So these are some of the practical ways that you can curtail the spread of COVID-19 within the household. I also want to encourage households to have a supply of Panadol, right? Because COVID-19 is a disease where you treat the symptoms. Have a supply of Panadol. Have a supply of vitamin C at home, zinc, right? Continue to eat a healthy diet. Continue to hydrate, right? So I encourage each and every household to follow those tips to curtail the spread within the household. Thank you.
That is really important, because a lot of what they are finding out is a lot of these cases are now happening at home. They are happening at home. All right, so one person is going out, everybody else is doing what they're supposed to do. One person goes out, comes back home, and plays mash up. You understand? So These tips are very important. Probably I will try to see if I can isolate this particular clip for you, for those of you who may want to go back to it, because those are the things that you need to do for the category of persons that I spoke of just now that needs to know their status but don't know, or probably you know your status but need to know how that you can survive while being at home with other people. Well, there you had it. All right, we are moving on. The La Soufriere boy, the government of St. Vincent and the Grenadines, we just jump in, so to come back, right? The government of St. Vincent and the Grenadines have lowered the volcanic alert level from orange to yellow, nearly 5 months after the eruption of the La Soufriere volcano. The National Emergency Management Organization, NEMO, in a statement said that the decision to lower the level was taken following the advice of scientists from the Trinidad-based Seismic Research Center, the SRC, of the University of the West Indies. All right, they are saying that it said that the activities at La Soufriere have declined for the last 3 months and are consistent with a period of unrest following eruptive magmatic activity or explosive eruptions, which can be seen by the emission of hot, degassing near-surface magma at the summit of the volcano. All right, now NEMO said that a yellow alert means that the volcano is still restless, seismic, or fumarolic activity, or both are above the historical level at the volcano, but have reduced significantly since the last eruption on April 22nd, 2021. All right, so people who are because there's no red zone, you know, so people in some of those areas who are evacuated and so on, they can now go back, you know, clean up and thing and organize their business. So today, folks, before we go to the break, by the way, let me see if we have the thing follow. Let me see if it's reached already. All right, no, so we don't do it yet. So we go talk. Give me a minute, and we'll go to the break, and then we'll come back. So today, I decided to do the thing. You know, after discussion with my family, in terms of weighing the pros and the cons, and just relying on someone else's judgment as well, because you know sometimes we rely on our own judgment to make tough decisions. But that should not always be the case. You see, because when your belly hurt, when you have a pain somewhere, you go to a doctor because probably they're in a better position to tell you what's going on with you. If something happens to your vehicle, you go to a mechanic and so forth. If you don't, you go to a teacher. Jano, or your grandparents, right? To teach you some street smarts, right? And so I find the decision to vaccinate or not vaccinate is probably one of the hardest decisions many people has had to make. Hands down. Yeah? They tell you read or they tell you to research, but you're getting research that puts you on both sides of the spectrum. You're reading this and you're leaning towards that side. You read something that is opposing and you end up there. So wherever you are at the time, that's where you lean. And then probably that's the cue that you need more than just your interpretation, right? That's when you get other people involved in your decision making. And so I spoke with my family, my immediate family, you know, in terms of weighing the pros and the cons. And I made the decision. And I will add it to the fact that they say if you catch COVID, you will suffer or you can suffer erectile dysfunction. You know, in other words, hey, you know what I mean? And, you know, I ain't play that kind of business, you know. I ain't want nobody break my stride, not this time in my you know, right. You know, because right now you're boy in the peak. So I made the decision and I did the business today, you know. At first I thought I was going to walk like Thriller. But it turns out I feel very fine and everything like that, you know. And you know me, I don't tell anybody to do or anything. I just say what I've done. You know, I'm very confident in the decision that I made for myself and my immediate family. And so we are all within my household. We have not been vaccinated because we took some time to, you know, to do our own research and to get ideas from others, you know, to help make that decision. And so this week we decided that this is the better option to go And so we've made that decision. So I did it as the first, go ahead, and then the other members of my family will follow, all right, as an agreement. So that's it right there. All right. So, yeah, but anyway, let me that talk. You know what I mean? So, but tell me, I think that was the most compelling thing for me. They say, well, you could end up with erectile dysfunction if you catch COVID and say, no, Papa. I mean, I could do it without a hand, I could do it without a foot. I could make it. Even with the glasses, I can't see too proper, but I'm good. I'm grateful still. But anything below there, nah. That is when it gets. Anyway, let me that talk, So, persons, we should be getting the. Let's get serious now, man. All right, so we should be getting the report in a while, the COVID-19 report, and once we get that in time, then we'll be able to share. We'll be able to share that with you. All right, and yeah. So let's take the quick break, and we are going to come back with the national report, with the weather, and if we get the COVID-19 report as well, and any other breaking news that we will get during the course of the night, then of course it comes in just around that time, between this time. All right, so let's take a quick break, and I'll come back. Stay right there.
Running low on groceries? Why not visit realvalueiga.com and experience our new online shopping platform? Place your order, then go out and enjoy your day to spend more time with friends and family. Free delivery available within select locations or in-store pickup available. Sounds simple, right? It is. Stress less, live more with Real Value IGA online store, where good food begins.
After being locked down during the pandemic, get ready for summer with Rika. Live this summer with Rika's Summer in Every Drop promotion. Buy any Rika combo of 6 200ml, 4 330ml, or 3 1-liter Rika juices and get a chance to win. Win Apple AirPods, plunge pools, beach chairs with umbrellas, barbecue grill set, gamer set, and weekly pop-up giveaways. With Rika, there's summer in every drop. Promotion ends August 31st. Tickets available at all leading retailers island-wide. Rika, distributed by Superb Distributors Inc., Tempe, St. George's.
It's your summer everything loan from the communal. Borrow up to $10,000 for all your needs. School supplies, staycation, home renovations, appliances or furniture. You can have it all with a summer everything loan. With competitive interest rates and same-day approvals, you can't beat this loan special. Not a member? Join today to get onto this exciting offer. It's your summer everything loan from the communal. Apply today and take advantage of this exciting offer. Visit the nearest communal branch or call us at 440-1755 for more information. Lending terms and conditions apply.
How going on, boy?
Hey, good old things.
Hey, easy.
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex, or give them a call, 440-1015 or 440-1016, or check out their website, hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada. It's your choice for affordable housing and a stress-free construction experience.
Summer is ending, but the deals are just beginning with the Court's end of summer sale. Get up to 50% off your favorite items, to include patio furnishings, pools, coolers, TVs, mattresses, and more. Plus, shop today with the Ready Finance and pay nothing for 60 days. Take advantage of these sizzling summer deals for a limited time only. Shop in store and online at shopcourts.com. Conditions apply. Courts, bringing value home.
A message by the Grenada Distillers Limited.
You want a hand sanitizer to do 3 things: kill germs, be gentle, and to go where you go. You can get all of that in our hand sanitizer. Hard on germs, gentle on hands, affordable. Remember, hand sanitizers contain alcohol. Keep away from heat and flames and avoid contact with eyes. Available at retailers island-wide.
A message by the Grenada Distillers Limited. Diamond Intercontinental Jewelry Store now has amazing deals, special discounted prices on wedding sets, watches, and selected jewelry. We sell top brand jewelry and watches like Citizen at the best price. We offer the best deals and customer service on the island. Opening hours Mondays to Saturdays, 9:30 a.m. to 5 p.m. Diamond Intercontinental Jewelry Store, located at the Esplanade Mall, St. George's, Grenada. Visit or call us today for 14-3114-232-1234 or WhatsApp 533-1581. Sale is on for a limited time only.
Are you prepared for the hurricane season? Do you have a plan? Remember, water is essential in any emergency plan. Determine your family's water needs. Ensure your storage containers are food grade and store at minimum 35 gallons of water per person per day for at least 1 week. Understand that your planning may be different this year because of the need to protect yourself and others from COVID-19. Take the necessary actions to ensure that your household has an adequate stored water supply should there be an interruption. Be prepared. NAWASA, committed to meeting customers' needs.
Welcome to Yogo. Most of you know us for our food delivery service and our food pass for free delivery from restaurants. But did you know you can also use us for grocery deliveries too? We've just added another 5,000 plus new items to Yogo Supermarket. And stay updated as we add more products and vendors. Yogo Services is our convenient skip the line offering. Let us pay your electric, water, and other utility bills for you. With us, you will be able to buy tickets, pay your rent, schedule bookings, and other services. Need a ride to get somewhere? Give Yogo Lyft a try. Select your pickup location and destination location and wait for our driver to collect you. Never have to worry about how you're gonna get to a place again. Please see website or app for our service locations. And sign up now.
This is the National Report for Thursday, September 16, 2021. In the headlines, second No Movement weekend comes into effect on Friday. Details to this story and more in the National Report. With the news in detail, I am Leslie Ann Johnson. The second of 2 No Movement weekends will take effect on Friday as part of measures to restrict the movement of people as government, through the Ministry of Health, tries to stop the rapid spread of COVID-19 positive cases in the country. A curfew will be implemented from 5 p.m. on Friday, September 17th to 5 a.m. on Monday, September 20th. During that period, people are required to remain confined to their homes. During the first No Movement weekend, close to 1,000 Grenadians were either vaccinated or tested through clinics staged throughout the island. That drive involved doctors and nurses from the General Hospital, doctors from the St. George's University, members of the Cuban Brigade, and Grenadian volunteers. During the government's weekly post-cabinet briefing this week, Acting Chief Medical Officer Dr. Sean Charles said the success of this outreach initiative depends on people's willingness to take personal responsibility for their lives.
The impact of this is not going to be seen now, it's going to be seen sometime later. The ones that you've vaccinated and protected, the ones that you've tested and you've advised, okay, now here is your result, you must proceed and behave in this manner. All right, if you're positive, this is what you're expected to do. If you're negative, this is what you're expected to do. All right, so we have achieved our objectives in that regard. All right, how successful we are will depend on whether the persons that we have advised appropriately, whether they will follow that advice. All right? Because if they do, then we should start seeing a reduction in the number of cases. We should start seeing, reporting less numbers. All right? And of course, that impact will not be seen right now. It will be seen maybe 2 weeks down the road. All right? Now, if they're not successful, then we are simply going to continue to see more cases. What we must understand is that COVID right now is spreading in communities, in households. This is where the fight is right now. And no amount of lockdown can really impact that. All right? It is the behaviors of the persons in those small communities and in those households that largely determines whether the disease would spread from brother to sister, from cousin to cousin, from, and so on.
2 more COVID-related deaths were recorded on Thursday. On Wednesday, close to 700 doses of vaccines were administered. Acting Director of Medical Services at the General Hospital, Dr. Taisha Donnell, advised that people need to get into the habit of taking care of themselves by doing annual checks and employing any other preventative measure that will help safeguard them against the virus.
At least once a year, persons should check themselves, go to see a physician, get your labs done, and see a status. We are also seeing persons coming in who did not know that they suffered from a chronic illness, and they presented with signs and lab tests which suggest that they had a chronic illness and they were not aware. So again, each one help one, everyone needs to get into that culture. We need to change our culture. We need to think of healthy lifestyles, exercise, diet, we need to make sure we do annual checks, because there are persons who will not know they have something until they get some infection like COVID-19, which would trigger everything off. And, we've seen a lot of cases like that, where the person develops COVID-19 pneumonia, and of course, the diabetes they didn't know they had, it shows itself up. So let us all make a conscious effort. Every one of us, let us all try to practice healthy lifestyles, exercise, proper eating, all right, proper rest, proper hydration, and most importantly, anyone who has not had a check for this year yet, then maybe now is the time to do that.
Health teams will provide services in St. Andrew and other areas in the coming weekend. Grenada's Prime Minister Dr. The Right Honourable Keith Mitchell has welcomed the launch of the Carriacou Digital Skills Task Force, which is intended to coordinate the Caribbean community's approach to developing and harnessing the digital skills of Caribbean nationals, ensuring greater collaboration and innovation. The task force, which has 2 co-chairs at the helm, will also help promote awareness of digital skills and provide technical guidance on skills development. Dr. Mitchell, who is also the lead head for science and technology, including ICT in the CARICOM quasi-cabinet, said the work of the task force is vitally important to what is envisioned as a human-centered, sustainable, and more prosperous digital future. Identifying the desire for a whole-of-CARICOM approach, Dr. Mitchell underscored the need to make it possible for citizens, or young people in particular, to gain the digital skills they need to navigate and succeed in today's digital economy. The goal, he said, is to build a CARICOM digital future where no one is left behind. The Prime Minister noted that the increased reliance on technology brought about by the COVID-19 pandemic has necessitated upskilling among the region's people.
Digital skills are required across the board, from agriculture to creative industries, to defense to hospitality, to transport and tourism. All sectors are reporting the need for digital skills. Therefore, sisters and brothers, to build and foster the CARICOM digital economy, we must embrace the role of technology and have a digital workforce. Young people today have a much higher level of education regarding digital skills and competencies. While they are often considered digital natives, the reality is that the majority do not possess the job-relevant digital skills. As a result, jobs requiring cloud computing, artificial intelligence, mobile app development are going unfilled. We need to change that reality.
The Grenadian leader opined that the digital transformation taking place will radically transform regional economies and affect how people live and work. He cited a need for CARICOM to dramatically advance digital skills for the workforce, particularly for low-skilled workers who are likely to be vulnerable to job loss.
I see a need for a new paradigm in CARICOM foreign policy. CARICOM has friendly working relations with many countries which are regarded as leaders in the area of digital talent and competitiveness. We must use these alliances to actively promote and garner assistance for the CARICOM digital strategy and to enhance the digital skills of all our people.
At Wednesday's launch, Dr. Mitchell acknowledged the overall progress being made by the region in the strategic use of digital technologies and provided an update on digital transformation in Grenada. He spoke of government fast-tracking its digital transformation agenda to create a more citizen-centric public service that is capable of delivering more online services. This initiative, he explained, is strategically aligned with a plan to improve digital literacy among citizens, which would allow them to better capitalize on the improved service delivery platforms. This is the National Report. More news after the break.
This is a message from the Ministry of Health. If you or a family member suspect that you may have contracted COVID-19 and are displaying symptoms, please immediately self-isolate at home. This means that you must also avoid all contact with other members of your household. Do not visit hospitals or health centers, as this creates the potential for further spread of the virus, and it puts additional persons at risk when you come into contact with them. Your best course of action is to call the COVID-19 hotline at 458-4787 or 538-4787, or contact your nearest health center or medical station. Once your information has been received, health officials will come to you. Help prevent the spread of COVID-19. This has been a message from the Ministry of Health.
Continuing the news, representatives of Grenada's two main political parties held a discussion on Thursday on fostering greater collaboration in addressing the COVID-19 pandemic and its current impact on the country and its people. Initiated by Prime Minister Dr. The Right Honourable Keith Mitchell and readily accepted by acting political leader of the National Democratic Congress, Adrian Thomas, The meeting underscored the need for unity in addressing COVID-19. Other attendees included Joseph Andel of the NDC and Anthony Boson of the NNP. After successfully managing the pandemic for more than a year, Grenada transitioned to community spread in recent weeks, and as of September 15, the country recorded a total of 2,210 active cases, the majority of which are locally transmitted. Thursday's meeting therefore underscored the urgency of the situation and the equally urgent need for a collaborative approach to curbing the spread of the virus and addressing vaccine hesitancy among Grenadians. Discussion points included the quarantine period for fully vaccinated persons entering the country, increasing the number of testing and vaccination sites across the country to reduce the potential for crowded venues, establishment of a separate isolation unit for COVID-19 patients, the recruitment of more volunteers to assist with public education, and manning the COVID-19 hotline, and improving the capacity of the hotline with support from telecommunications providers. The meeting also identified the need to expand the list of potential beneficiaries under the COVID-19 economic stimulus package to bring greater relief to persons affected by the temporary closure of many non-essential businesses and who have been left without an income. It was also suggested that government encourage utility companies and financial institutions to offer moratoriums to customers as a means of financial relief. Efforts are already underway to address some of the areas highlighted, but there was a general agreement to give consideration to more of these. Mention was made of the willingness of persons in the diaspora to support COVID-19 initiatives in Grenada through donations, and the NDC representatives proposed possible concessions, an idea the Prime Minister commended the NDC for, and agreed that consideration can be given to a clear and transparent proposal for same. Finally, in the news, Prime Minister Dr. The Right Honourable Keith Mitchell met with Opposition Leader Honourable Tobias Clement on Wednesday to discuss issues related to the COVID-19 pandemic. Dr. Mitchell, who was joined by Health Minister the Honourable Nicholas Steele, provided clarity on issues raised by the Opposition Leader, in some instances assuring him that his suggestions are initiatives already being pursued by the government. The Prime Minister reiterated his call for more voices to be heard, providing positive messages to the people of Grenada, Carriacou, and Petite Martinique. With the current rate of infection attributed to community spread, change in human behavior has been cited as one of the key factors to curb the spread of the virus, and Dr. Mitchell underscored the clarion call for all hands to be on deck. He said, and I quote, "We need to unite forces and do whatever we can to arrest the spread of the virus. People are scared, lives are at stake, and as leaders we must maintain confidence and help guide them through this difficult period. Now is the time for us to hold hands and work together to save lives. There will come a time for political points, but now is not the time. I must commend you for the initiative in bringing about this meeting. This is about unity in the fight against COVID-19, unquote. The Prime Minister assured the opposition leader that government is doing all it can to manage the pandemic. He referenced assistance being sought from friendly countries, particularly a field hospital, to accommodate the growing number of COVID-19 patients requiring medical intervention. Other areas of conversation during the 30-minute meeting were community outreach, support from the diaspora, additional social assistance for persons in need, and entry protocols. And that's the National Report. I am Leslie Ann Johnson.
Okay, so thank you very much, Leslie, and it's a pleasure all the time listening to you read news. It's amazing. And of course, we have for you the weather. We have just checked for the COVID-19 dashboard. It has not arrived as yet. Okay, we'll do like we usually do. We will send you that that update via our WhatsApp group. If you have not yet joined the group, send us a message, and we will be able to add you to the group, and you will get the updates. All right. Weather: partly cloudy and breezy with light to moderate showers, some of which may become heavy at times, and a low chance of thunder. Tonight's minimum temperature 25.5 degrees Celsius. Winds easterly to southeasterly at 14 to 24 miles per hour. Seas are moderate with waves 4 to 6 feet in open waters. And that's our weather report for tonight. And as usual, we have to big up a few people on the program. So let's say hello to you, my dear friends. How you do? Okay, all right. So we have with us tonight Ansha. All the folks, well, before I even go to Ansha, all the folks who are currently on YouTube, big up to you, all right? We have for you Java, Celine, Doris, Della, Angel, Raven, Mom, Lintona, Meryl, thank you very much, and Nurse Lyons, and the other nurse, I didn't get her name. Thank you guys for being so professional and everything, you know. Okay. Pearl, Sheba, Hazel, Cherry Ann, Angel. Here's small man gain on it. Cynthia, Glenda, Atalia, Jen. And everyone else, thank you for joining us. May God bless you. And we will meet again tomorrow, God's willing, in one piece. Okay? In one piece. We're all going to come back here. All of us. All right? So let's live deliberately with an aim to being back here tomorrow. All right, Spice Girl. All right, Ezran. All right, Theresa. And I said Cherry Ann already, right? Yeah, man. Everybody. Thank you. Kingsley as well, and Yvonne and Janelle. Kirin, yes. Yeah, small man sounding the alarm. You know, when you hear, when it's 10 o'clock, you know, it's mass. All right, Denise and Claudette. All right, well, Claudette, you could watch it whenever. All right, Cassie and the others, may God bless you. Let me see what again, you know. Yes, Nurse Charles. So we have, how you have so much Charles in the, no, seriously, how you have so much Charles in the medical fraternity? Something not right. You know? Yeah, well, I know about 100 Charles. You understand? So, Nurse Charles, Nurse Lyons, Mariel, Nurse McQueen, and the folks in the Ministry of Health. I got first-hand experience of what the end of the day looks like for them. And they're saying the end of the day is calmer than the beginning of the day. I'm like, really? It's a crazy place. I don't know how they keep their sanity. You know, I respect nurses even more. You know, with medical stuff all around them, phones ringing off the hook. I wouldn't be able to deal with that. I go crazy. I just pull out all my hair. The hair won't grow. You might just see spots. You know what I mean? Yeah, but it's overwhelming. Just being around and having to see the phone is not stopping. It's just going and going and going and going and going. There's a health center that is calling to get some supplies. And so sometimes we are really hard on the system, not knowing what the system has to go through, what the people in the system has to go through. And so what we see are just end results. And then we judge based on that. And we don't put ourselves in people's position. Yeah, but I could tell you, no sir, it's tough for them. All right, so guys, let's exercise a little bit of tolerance. You know, not a little bit, a lot. Tolerance and thing, you know, because you have no idea of what these people have to go through on a daily basis. All right, and it's not for themselves, but it's for us. Okay, so a word to the wise. Take care, guys, and may God richly bless you and the family. All right, let's go. Let me just make one more check before I go. So again, we just send it on the update for you. Yeah, the Chief Community Health Nurse. Hello to you. All right, so we have a lot of you on board. So blessings to you as well. All right, everybody, blessings to you. Let's go. In 5, 4, 3, 2, 1. We all say, ja! No. Take it all.